I am Roderick Sawyer, and I serve as Alderman of the 6th Ward, and I want to welcome you to the 6th Ward at the great Salvation Army Red Shield Center. I see B, who's been a great partner in working with the Salvation Army, and we have a new captain here, but we're really happy to be here in the area. This is a turning point in the city of Chicago. I think we've been doing well thanks to our efforts in the city of Chicago and all our partner agencies in getting shots in arms. But as you know, we're not quite there yet. So I want to thank the mayor and the Department of Health and everyone that is making this renewed push in getting shots in arms. I'm appealing to everyone here in the city of Chicago. If you don't get the shot for yourself, get it for someone that you love. Get it for someone that you care about, because it's not just about you, it's about everyone being safe. So I'm going to introduce the mayor as she outlines our new strategy in getting shots in arms in all 77 communities in the city of Chicago. And with that, I'll introduce our mayor, Mayor Lori Lightfoot.
All right, good. Good morning, everyone. It is such a pleasure to be here. And let me just give a little bit of praise and thanks to Alderman Sawyer. As you know, he is the chairman of the Health Committee and has been an invaluable partner for us on this pandemic journey. And as he was speaking, I was reminded of when we got our vaccinations, we got our first shot together, and he was so eloquent that day in talking about the responsibility that he felt as a black man to really step up and get vaccinated. And I want to just repeat those words because they have stayed with me, they resonated with me that day. And a lot of what we're talking about here today is really going long and deep in neighborhoods where we've been in, we've never retreated, but we have more work to do. And I'll talk more about that in a moment. But let me recognize the other leaders that are with me here today. Of course, our incredible champion, Dr. Allison Arwady from the Department of Public Health, Dr. Geraldine Luna, also from the Department of Public Health, United Airlines Vice President of Government Affairs, Dan Lynch, and they've got a great story to tell, and I'm excited for them to tell it. Carlos Nelson, who leads the Greater Auburn Gresham Development Corps Executive Director and is a Healthy Chicago Equity Zone community lead. Thank you so much, Carlos. And my pastor, Bright Star Church, Pastor Chris Harris. If there are many religious leaders across our city that do great work every day, but this man really stands out for what he does in the community, really talking about not just public health, but mental health and ways in which we must work together to heal communities. Pastor Chris, I am really grateful for you. And I got to give a shout out to behind the cameras, the team from CORE. If you all could just, the CORE team has been with us almost from day one of this journey. We got introduced to CORE through Los Angeles, through the Reverend Jesse Jackson, talk with Sean Penn, who really started CORE as a result of the earthquake in Haiti now over 10 years ago. And they have been with us every step of the way, from education to testing and now vaccination, and really grateful for them. Got to give a shout out to Team Inglewood. They are fearless in everything that they do. Thank you all so much. It was exactly 11 months ago, on October 27, 2020, that Dr. Arwady and I joined the former commissioner of BACP, Rosa Escarena. We were looking at a very grim set of circumstances then. You'll remember that time was the beginning of the second major surge in COVID-19. Just when we felt like we were coming out of the woods, we started to see that uptick again. And at that time, our city was experiencing a lot of trauma, a lot of despair. And we just passed the highest daily case rate we've seen since the tail end of the pandemic's first wave back in May 2020. Because of what we were seeing in the data, myself, in partnership with Dr. Arwady and the business and community leaders, were forced to put businesses in curfew, as well as encourage residents to refrain from gathering more than 6 people in gatherings of any kind after 10 p.m. That decision, like all others made during the pandemic, and at the height of that second surge, was incredibly difficult. There have literally been no easy decisions through this time. But we knew that it was absolutely necessary in order to protect the health and well-being of our residents, and that has been our #1 priority throughout the pandemic. The efficacy of these kinds of decisions, of course, is directly linked to our residents' willingness to follow public health guidance and to do their part to slow and stop the spread of the disease. And it's because so many of our residents did just that. They stepped up and did their part that we were able to make it out of that dreaded second wave and open up our city. When we opened up on June 11th of this year, we were the largest big city to open in the country. And that is because of the following of the guidance, the sacrifice of so many that really made opening up possible. And that began our steps towards normalcy. Now, just shy of a year later, we have yet another opportunity to come together as a city and do our part to put this pandemic behind us once and for all. While we are incredibly lucky to have a safely reopened city and the ability to resume working, playing, and interacting with each other in ways that we weren't thinking would be possible, there's still more to do. There's still more that we must do. COVID-19 pandemic is still with us. It's still here. The Delta variant is still very present, and it is deadly. So we are not out of the woods by any stretch of the imagination. But that's why I'm proud to announce the launch of Protect Chicago 77. 77, of course, representing all of our community neighborhoods. Our latest initiative to vaccinate even more residents and turn the chapter on COVID-19. This citywide effort, and I want to emphasize, it is a citywide effort where we don't want to leave a single person who's eligible for a vaccine behind. This citywide effort, community engagement campaign, is unique in that it directly calls on and empowers all of us to take our shared responsibility in fighting this virus. Currently, more than 1.6 million, or that's about 72.4% of Chicagoans aged 12 and up, have received 1 dose of the COVID-19 vaccine. That is incredible progress, but it's not enough. And let me share some data with you why we know it's not enough and what the moment demands and the urgency that we have. There are zip codes in our city where the vaccination rates are 50% or less. 50% or less. If we do not make giant leaps forward there, every unvaccinated person in those zip codes is at extreme risk. And let me drill down on that a little bit more. Right now in Chicago, if you are unvaccinated, on average, you are looking at 15 times the possibility that you may die from COVID-19 than somebody who's vaccinated. That's the average. And let me break it down a little further. That number increases exponentially if you are Black and Latinx between the ages of 50 and 60. Let me tell you, if you fall in that category, Black, Latinx, 50, 60, the probability of death from COVID-19 if you're unvaccinated is approximately 50%. 50%. Now, folks, if that doesn't take your breath away, if that doesn't make you have a sense of urgency about getting the vaccine, I don't know what will. And there's a lot of young people in the room, and I just want to make sure I'm talking to you too, because folks, if you are Black and Latinx between the ages of 18 and 39, you also are at risk, and your vaccination rates are painfully, painfully low. So what we must be about is making sure that we change the trajectory of these numbers. I don't want people playing with their lives, and that's what I feel like when I see these numbers every week. So this has to be all in. And as Chairman Sawyer said, if you don't see the necessity of doing this for yourself, and I hope you do, Do it for somebody who you love, who depends upon you, whose presence, your presence in their life makes a meaningful difference. What we're seeing showing up in hospitals across the city are not people who are sick who have been vaccinated. We're seeing people who are showing up in hospitals, going into ICU and being ventilated who are unvaccinated. 97% of the people who are showing up and having lengthy stays in the hospital because they're getting sick are the unvaccinated. Now, if I haven't drilled this enough, I'm going to keep talking about it, and that's what this campaign, frankly, is about. So we are launching Protect Chicago 77 to make sure that we emphasize the fact that we're not out of the wood, that we have more work to do, and that we are committed as a city to make sure that everybody gets vaccinated and nobody is left behind. We've got to do more to protect our residents, and we're committed to doing just that. And it's for this reason that Protect Chicago 77 is designed to engage residents in all of our 77 designated community areas with the ultimate goal of ensuring that at least 77% of residents aged 12 and up have received at least one dose of the COVID-19 vaccine by the end of this year. One dose. I think that's a modest goal. A modest goal. I'd like to see everybody fully vaccinated by the end of the year, but I'm going to settle for one dose. Now, to reach this goal, the city will not only work with community leaders, as the folks that you're going to hear from today, to identify key action steps that residents, businesses, organizations, and healthcare providers can take. One thing that we have learned well through this work is that it's not one size fits all. We've got to customize and tailor our approach depending on the circumstances, depending on the community need, and we hear that from stakeholders that we are engaged with on a regular basis, and we want to adapt accordingly. So we are going to be very flexible to make sure that we're bringing community-specific interventions and resources to get the job done. We're going to offer a variety of resources, including videos, tips on how to have that conversation with somebody who isn't vaccinated, so that we can give you that tool. And if you go to chicago.gov/covidvax, you will be able to find weekly updates on our progress, because we're going to measure ourselves and hold ourselves accountable to push forward and break through. And getting to a 77% citywide vaccination rate, and we will be portraying the stories of real Chicagoans on their decision to get vaccinated and more. So there's going to be a wealth of information that'll be available. We'll be updating that as close to real time as possible, but we want people to know that there is a resource out there. We know that these conversations are challenging, that people still have a lot of myths and concerns and hesitancy about the vaccine. But one thing I do want to emphasize, and I know Dr. Arwady will also talk about this, folks, the polling that we have seen is a small percentage of people in Chicago that are unvaccinated are saying, never me. Very small percentage. The vast majority of the people that are unvaccinated, and we know that literally from going door to door, is they need to make time for it. They still have some questions about it. They're not rigidly against the vaccine, so I want to make sure that that point is loud and clear, that there is a real opportunity for us to continue that outreach and reach people and bring them this life-saving vaccine. So as I previously mentioned, Protect 77 doesn't just call upon residents to join in this new vaccination effort, but businesses as well. That's why local businesses of all sizes who have put in place policies requiring vaccination to keep both their employees and patrons safe are invited to complete an online survey to be self-certified and to earn a badge that can be displayed in your place of business. This tells patrons that these business owners are not only taking the pandemic seriously, but they are actively engaged in our citywide efforts to overcome the crisis, from stopping the spread of misinformation and supporting businesses in one's community that make vaccine safety a priority. How about that? Or even talking to a reluctant friend or family member about why it's so important to step up in this moment. I want to emphasize this again. Every single one of us can do something more and something meaningful to help us reach this 77% goal across our city. So if you are currently unvaccinated, folks, now's the time. We're here on the south side in Inglewood. We've got vaccination set up right now. We'll bring it to your house. We've been going door to door in communities all over the city, bringing the vaccine for folks that don't want to come out. But the vaccine is readily available at pharmacies all across the city, your healthcare provider, whatever it takes. We want to get the vaccine to you and you to get the vaccine, so we're willing to do whatever it takes. So please visit chicago.gov/vaccine finder to find an alternative location or to set up an appointment to get vaccinated in the comfort of your own home. You can call 312-746-4835. That's 312-746-4835, and visit chicago.gov/at-home. That's chicago.gov/at-home. We are making it as easy as possible. Your healthcare provider, the pharmacy, you can call and make an appointment to come and have your whole household vaccinated. We will be there for you. And remember that what we do now determines the trajectory of this last leg of our COVID-19 journey. You know, that we have a lot of great things that are happening in the city, but one of the things that's holding us back is the level of vaccination rates. We don't want to be like other parts of the country where we've seen this explosion brought on by the Delta variant. And let me also just say, for our seniors, 65 and up, we got to make more progress. So if you are vaccinated, but you know Granny isn't, or Grandpa, or somebody in your life that's 65 or older, get them to a vaccination clinic. Help them get educated and overcome whatever hesitancy they might have, because this virus and the variant are ruthless when it comes to people who are older. We don't want to see our elders suffer any more than they already have, so we've got more work to do on that. So, last thing I'll say is this: we're always better together. We're always better together. That's why we're making this a citywide campaign, not just focused on certain neighborhoods. Of course, we're going to continue that work because that's necessary, but this is something that everyone in the city should take advantage of. If you've already been vaccinated, talk to somebody else. Bring a friend, bring a family member, get them vaccinated. Don't stop until we reach our goal. So thank you very much, and it's my pleasure to welcome up Dr. Allison Arwady.
Thank you, Mayor, and thank you, everybody, for being here. We have been making really good progress in Chicago against COVID, and that is thanks to the way our 77 communities have stepped up. The community organizations within them, the business leaders within them, the faith leaders within them, the individual Chicagoans who have said, it's not just enough for me to get vaccinated, I'm also going to take that next step and find someone who isn't, have a conversation about it, and move my neighborhood forward. We all are very used to talking about our 77 communities in Chicago. Neighborhoods are one of our real strengths. There is a lot of cohesion built up within these neighborhoods and amazing resilience within them. The reason we have tagged 77% as a goal here is not that 77% is a magical number in terms of hitting herd immunity, but it reflects those 77 communities, and it's getting there. When we can get to a point where more than 3/4 across Chicago have gotten at least that first dose of vaccine by the end of the year, and as you heard the mayor say, our stretch goal would be that we hit at least 77% for fully vaccinated both doses, we will have made amazing progress, and we will be standing above most of the rest of the country. Already here in Chicago and in Cook County, we are the third most vaccinated county of the 97 counties in Illinois, following only Lake and DuPage counties. And I'm more proud, though, that we are doing everything we can here in Chicago to not just hit an average benchmark, but to make sure every community is part of that progress. So just in the last week, we hit an amazing milestone here in Chicago. Every zip code now, the majority, at least 50% of eligible Chicagoans, meaning those over the age of 12, have gotten a first dose of vaccine. Applaud for that, please. And I can't tell you enough how much that is not true in many places. Where we look at places that are having major surges with COVID, we see zip codes that are 20% vaccinated, 30% vaccinated, and some of that includes right here in Illinois. So yes, we're hitting 77% as a city if I have anything to do with it, and if our partners in the room and across the city have anything to do with it. But also, we are moving every one of those 77 communities. And we passed out to the media, and I'll encourage people to go on our website. You know I love data. chi.gov/COVID- does have zip code level data related to how we're doing on each zip code, and every single week you can see what was the improvement. But even within zip codes, there can be some variation within communities. And so we passed out to the media, and we'll be making available and updating weekly the community level statistics. And I would like every Chicagoan in all communities to know your numbers, because we are not done in any community in Chicago. And every person who gets vaccinated, no matter where you are, pushes our city toward that 77% goal. We're standing here in Englewood today. We're going to hear in a moment from Carlos Nelson, who leads the Greater Auburn Gresham Development Corporation. We also have Teamwork Englewood here in the room. And GAGDC and Teamwork Englewood are examples of real standouts here in the city. Greater Auburn Gresham Development Corporation is the lead organization for the Healthy Chicago Equity Zone. As a reminder, the city has been divided into 6 zones. Every neighborhood is in a zone because every part of the city has neighborhoods and groups to work on. And then in addition to the regional leads here in near South, it's GAGDC, in turn, the city is funding those, and then they are funding community-based organizations in every single community. So here, Teamwork Englewood is getting it done. I want to thank the Salvation Army. This is a site that, repeatedly has been a very good site, double digits, when we're standing up pop-up vaccines. And Teamwork Englewood, for example, they're doing a pop-up, I know, just down the street at St. Bernard's later today. But the important work here is the fact that these are trusted voices and organizations from inside each community, because we have learned it is not enough to be efficient, and it is not enough just to talk about equity. It is about putting the resources into communities to drive the goals of those communities. And I would like to point out that Englewood, which when we ran this last week, 50.9% had gotten at least a first dose, so the majority have gotten at least a first dose. Cheers for that. But also, look at the percent increase from the previous week, and you will see Englewood had the highest percent increase of any community area. 2.9% in a week. That is the kind of work we need, and that is what the results that we are seeing. I do not want you to give up hope about vaccinating people in Chicago. This conversation has been polarized in a lot of ways at the national level. We're lucky here in Chicago that, as you heard the mayor say, there are a small number of Chicagoans who have said, you know what, I'm not doing it unless perhaps I'm required to by my workplace, by my school. But there is a much larger group, more than twice as many here in Chicago when we poll, who say, I'm still thinking about it. I still have questions, or I just haven't gotten it done. And it is the neighborhoods that have the furthest to grow that will help us the most meet that 77%. And it is not enough. It's not just about doing the right thing. This is how we control this disease. From an epidemiologic perspective, it does no good to have half the city 90% vaccinated and half the city 30% vaccinated. That doesn't get us past COVID. Getting every neighborhood done is what does it. And so we're going to hear from business partners, as development partners, and faith partners. And over the next few weeks, you'll be hearing additional things that we're doing in each of these spaces. I want to finish just by stating that we've been funding through DCASE a number of artists who are based here in Chicago and have been creating art about vaccine, again, reflecting communities. And I saw one last night, we actually posted it on our Facebook page, that had done a play. It showed the Chicago Star, and it was alternating between two words, immunity and community, and emphasizing the root. Immunity, community is the word unity. We get past COVID as a city by being unified on this and by having all Chicagoans take that 77 pledge. I'll get vaccinated, and that's not enough. I'll go beyond, I'll reach out. We'll have resources available with videos to help you have those difficult conversations. We'll have some focus on seniors, we'll have some focus on youth, but I do not want you thinking we are done vaccinating here in Chicago, because this is how we are going to get through the winter. We're not done with COVID. I wish we were, but boy, have we gotten through Delta so far better than just about anywhere else in the country, and that is due to the work of these community groups here on the ground and the unified approach that we have taken. So I am absolutely thrilled to bring up to hear from an employment perspective, Dan Lynch, the Vice President of Government Affairs at United Airlines, an obviously large employer here in Chicago that has made news, not just here, but around the country for some real leadership in terms of vaccination work. So welcome, Dan Lynch, and thank you.
Good morning. Thank you, Dr. Arwady, Alderman Sawyer. I also want to thank Mayor Lightfoot for your leadership throughout this pandemic and for the opportunity to join you here today to share the industry-leading approach that United has taken to take care of our customers and our broader United family. I'd also like to thank the doctors, community leaders, faith leaders who are here today for everything that they've done to keep Chicagoans safe during this pandemic. Since day one of the pandemic, United's employees have been on the front lines at our airports and aboard our aircraft, both here in Chicago and across the globe. And in turn, United and its employees have taken a leadership role in the pandemic recovery. United was the first airline to mandate masks for our employees and to introduce customer COVID testing and contact tracing. United has transported millions of pounds of vital medical supplies, from PPE to oxygen canisters, and has shipped tens of millions of doses of the COVID vaccines across the world, with the very first shipment arriving here at Chicago's O'Hare Airport many months ago. Throughout this time, United has been direct and candid with our employees and our customers about the steps we're taking to keep people safe. Over the last 9 months, we've learned a lot about this disease, including how vaccines by far are the most effective way to protect people from COVID-19. That's why at the start of this year, United announced that we intended to require vaccines for all our employees when the time was right, because it was the right thing to do. As Chicago's hometown airline, safety is United's top priority. The pandemic has placed an even greater sense of urgency on protecting the health and well-being of the people that work for United. When United announced our U.S. employee vaccination policy just a few weeks ago on August 6th, we made clear that we were making that announcement for one reason: to keep our people and our customers safe. I'm proud to announce that as of yesterday, 97% of United's U.S.-based employees are now vaccinated. Alderman Sawyer, that includes dozens of United employees right here in the 6th Ward and thousands of other employees across the city of Chicago. While we continue to be encouraged by the outpouring of support and appreciation we receive from our employees, we recognize the decision to get vaccinated has been difficult for some. But we also know that everyone is safer when everyone is vaccinated. Mayor Lightfoot, we commend you for launching the Protect Chicago 77 campaign. You have United's commitment to do everything we can to get Chicagoans vaccinated, and we encourage other business leaders to join in and support the cause. Thank you again for the time, and now it's my pleasure to introduce Carlos Nelson from the Greater Auburn Gresham Development Corporation.
All right. Good morning, everyone. I want to echo something that Dan said, and I just really want to show my appreciation to Mayor Lightfoot, not just her leadership as it relates to COVID crisis response and now recovery, but her focus on economic development on South and West Side communities through the Invest Southwest initiative. Thank you, Mayor Lightfoot. You have been a tremendous, tremendous role model for me and my team. You used an adjective to describe, you called him Chairman Sawyer, eloquent. I would also add the adjective of passionate, as Alderman Sawyer, I'll just call him Brother Rod because she's my brother, has had a lifelong passion to really rebuilding his community in the city of Chicago. So thank you, Alderman Sawyer, Brother Rod, Chairman, what other? Very right, my birthday twin as well. And Dr. Arwady, I mean, daily, weekly, you know, your presence has been really a steadying force here around the city. And you used the word trust, which I think is so appropriate today. So welcome to Inglewood and the Near South Healthy Chicago Equity Zone. My name is Carlos Nelson, and I'm the CEO of Greater Auburn Gresham Development Corporation. And as an inaugural member of Mayor Lightfoot's seminal racial equity rapid response team, Greater Auburn Gresham Development Corporation has been at the forefront of combating the pandemic in our Southside communities. Historically, as most of you know, our communities have been systematically deprived of resources, deprived of investment, and deprived of access to a host of social determinants of health factors. And we saw how COVID has ravaged our communities because of these long-standing inequities. The Protect Chicago initiative, in parallel with CDPH's, in fact, I'd like to give a round of applause to the whole team at the Chicago Department of Public Health and this whole notion of vaccination movement. So the Protect Chicago initiative, 77 initiative, in parallel with CDPH's Healthy Chicago Equity Zone work, which is being led by community-based organizations and community leaders like those here today. It refocuses the decision-making. It builds on the trust as the elemental force, and it empowers our community. And so I would also like to take a moment and publicly acknowledge frontline workers like our COVID crisis response team and other community partners. I think we could do a little bit better than that. The kindness campaign. Yeah, come on. I am here in my vest because I am indistinguishable from the team that is on the ground. And my kindness campaign partners who didn't stand up, we're going to give it up to you guys as well. We are all here to take the Protect Chicago 77 pledge and implore others to do so as well. Here in the Near South Healthy Chicago Equity Zone, Trusted organizations and community leaders are creatively approaching the goal of vaccine equity. Organizations like our host organization, Teamwork Inglewood, Deborah Strickland, thank you. And I shouldn't have started with that, but I'm going to keep listing them. Centers for New Horizon is a partner. Greater Albany Gresham Development Corporation, South Shore Works, Chicago Family Health Center, Project Hood, the Kindness Campaign, Bright Star Community Service Organization, whose dynamic leader, young and dynamic leader, well, he used to be young when we met, but you'll hear from shortly, and others. We are all educating residents, reducing barriers by launching local vaccination events, workshops, and incentives to help our city recover. We must continue to work together and trust in each other. So let's all take responsibility and make the Protect Chicago 77 pledge so that each and every one of us is doing our part. And with that, I would also like to bring up my pastor, that young dynamic leader from Bright Star Community Service Organization, Chris Harris.
You say, good morning, everybody. I'm a preacher, so you got to talk back to me. Good morning, everybody. It is a pleasure to be here with you all today. I am Pastor Chris Harris, Senior Pastor of Bright Star Church Chicago in the Bronzeville community, also the pastor of St. James Church Chicago in the West Pullman Roseland area, and I'm also the founder and CEO of Bright Star Community Outreach. In a time of crisis, there are three things that you need. Everybody shout these words. Say leadership. Say vision. Say partnership. And you all have to do me a favor. Go crazy for our great leadership who's leading us through these different efforts. Mayor Lightfoot, come on, clap. Chairman Sawyer, Dr. Arwady, Dan, thank you, Carlos, and all of you all that are in this room, and all of you all who have taken leadership in your homes, in your communities, and in your churches. I'm really excited to share that all of the entities and organizations and collaborative that I'm blessed to lead, we have been responsible for making sure more than 1,000 people got vaccinated. And I'm proud of that work that we've been able to do. And we're looking to do more than that for three specific reasons. First, I personally know more than 87 people who have died from COVID. Let me say it again. I personally know 87 people who have died from COVID over these last 19 months. And that does not include all of the members and employees that I have who have many people in their family and friendship circles, their constituencies, who have also died. This is real. And that's why you need leadership. Vision is foresight with insight based on hindsight. But you also need partnerships. Because no matter what the mayor, Dr. Arwady, Chairman Rod, or any of us put forward, if you don't partner, it doesn't get done. It's important that you understand my love and my concern for those who yet live compelled me as a faith leader to get involved. The pain, the trauma, and the sleepless nights from those who have died convinced me to do everything that I could to use my influence to keep other people alive. You got to understand also that I too was skeptical at first. I was one of the main ones that at first said, I'm not taking that. I was one of the main ones that said, I'm gonna wait until white folks take it and see what happened to them. Until I realized I was walking through the valley in the shadow of death myself. So that's the first reason that I got involved. The second reason is I partnered with hospitals like the University of Chicago Medicine, to learn more about what I call the 3 V's. And I got sick of all of them. The virus, the vaccines, and then the variants. And after I got informed, then I reached out to my friends over at Northwestern Medicine, and we together created a show called Clergy and Clinicians to inform Black and brown Chicagoans about Black and brown health issues through Black and brown doctors, physicians, clinicians, and experts. Now listen, tens of thousands of people have watched those shows on Clergy and Clinicians on our website, brightstarcommunityoutreach.com, and other platforms. And people are constantly calling saying, Pastor, thank you for this information and doing what is right beyond the pulpit on Sunday. The information these experts and professionals continue to provide has fueled my fire to eradicate any misinformation that's being spread through our community and do what I can to save lives. The third reason, then I close. Finally, one of my favorite scriptures in the Bible, Hosea chapter 4, verse 6, declares, my people are destroyed for the lack of knowledge. And I, like the writer of 3 John chapter 1, verse 2, he said, beloved, I wish above all things that thou mayest prosper and be in health, even as your soul prosper. So hear me good. As I watch daily on social media, there are far too many uninformed experts who recklessly share inaccurate information that could potentially be causing our people to lose their lives or their loved ones. Please hear me, Chicago. I'm asking every faith leader, every faith community, and every house of worship to join me in the process of saving lives in Chicago and beyond until we overcome this deadly virus. And I'm going to say something and see if you'll act like you had one of my churches and clap after I say this. We will overcome this virus. I don't hear y'all. We will overcome this virus. Protect Chicago 77. The number 7 in the Bible represents perfection and completeness. And with the number 7 twice, this campaign aims for double the amount of all people in Chicago communities to be completely vaccinated. Now, it is not my job to tell you what to do, but I have a moral and spiritual responsibility to suggest to you what you should at least consider. So as we walk through this valley and shadow of death, fearing no evil, knowing that God is with us, I ask that we follow the leadership, we run with the vision, and make sure we are all active partners. I am proud to bring back up our great mayor of this city for Q&A. Clap your hands for our visionary leader, Mayor Lori Lightfoot.
Now, normally when you end a church service, you say, are all hearts and minds on one? And I have to tell you from Pastor Chris's comments, it lifted my spirits, and I hope it lifted all of yours. Happy to take questions.
Thank you, Mayor. Members of the media, Alejandra Flores will be passing down the mic. Let's kick it off with Mary Ann Aher, Channel 5 on this side, your left side, Mayor.
Thank you, Mayor. It's been announced that President Biden will visit Chicago next week. Vaccination efforts will be highlighted. You're still in talks with the unions, especially the FOP. Will testing remain an option for those city workers who will not be vaccinated?
Well, look, what we hope is that everybody gets vaccinated. You know, as I talked to countless union leaders, union members throughout the course of the pandemic, one of the things that they've emphasized over and over again is concern for their own health. And the only way that we can really, truly maximize safety in the workplace is through vaccines. So our discussions continue and I'm hoping that we are able to reach an agreement, but we have to move forward with making sure that vaccines are a condition of our employment, and I'm hopeful that we're going to be able to make progress. Now, the FOP is a different breed, as we all know. And I would just want to say to the members of the FOP, just this week, we memorialized the stars of 4 police officers, all of whom died last year, all of whom died of COVID. The devastation of their families is profound. It is still real and raw. And so when I think about that, and I think about those 4 families that will forever be grieving because of the loss of their loved ones, their fathers and husbands, and people that they depended upon for strength and counsel, I just urge every single member of the Chicago Police Department to step up and do your part to protect yourself, protect your family, protect your community by getting fully vaccinated as quickly as possible.
Could you refer to the presidential visit next week?
Sure. We're just in early stages of those conversations, so I don't really have much to report at this point. The outreach began a few days ago. We're hoping that he actually will come, but as you know, world events and can lead things in a different direction. But the president's been very strong. I really commend his leadership on vaccines, what he's done at the federal level, also his leadership internationally, and really challenging the global community. Just as we won't be fully out of the woods until we significantly increase the percentage of people that are vaccinated across our neighborhoods, we won't be fully safe until we increase those percentages in our country, but also in our world. And we know that there are a number of countries that are way behind because of lack of resources, lack of access to doctors and nurses, health care, but also lack of access to the vaccine. So I'm hoping that when the president comes, he will also talk about the necessity of the United States to be leaders in this effort. We were leaders here in Chicago earlier this year because of the way in which we practice vaccine efficacy. We were able to take some of the unused vaccine and it was shipped overseas where it was needed, but we need to see more leadership. And I'm excited and thrilled, obviously, that the president will be coming here to Chicago.
I have a question for Dr. Arwady, if possible.
Yep.
Thank you, Doctor. There are some reports coming out about a potentially dangerous new variant called R1, with some cases already being seen here in Illinois. What can you tell us about this variant? Are you concerned?
So we are going to continue to hear about new variants every few weeks from here on out until we are past this. Let me remind folks about the way variants work. Whenever a new variant is detected, it happens every day where because the genetic fingerprint of the virus is taken around the world, we see a small change that gets uploaded to a global database. Most of the time, that has absolutely no impact on the way the virus behaves. When we see a number of the same mutations emerging, or we say this could be something to watch, it's labeled a variant of interest, a VOI. And that literally means this is interesting. This is something we should pay attention to. It could turn into something. Only if that variant of interest is shown to have a significant impact in terms of evading vaccine, being more contagious, like the Delta variant just now, or something else that makes it really significant, then we call it a variant of concern, because it's gone from being something interesting to something concerning. And then finally, there actually is a variant type that is called a variant of high consequence. We have never had a variant of high consequence yet. If we get a variant of high consequence, that would mean, for example, Delta, which is currently a variant of concern, is able to mutate further to a point where these vaccines are not working well, for example, and we saw a major change. So you're going to continue to hear about new variants. We're keeping an eye on them. They get formally designated a variant of interest either at the international level by the WHO or at the national level by the CDC. We don't pay a lot of attention until they at least get that variant of interest notification, and honestly, they don't have a major concern for us until they are formally labeled a variant of concern. So I would encourage everybody, as you hear about these variants, recognize that honestly, getting vaccinated is what gives the virus less opportunity to transmit and mutate. Every time the virus transmits to a new person, that is the opportunity for a mutation, a variant to emerge. So when we get vaccinated, not just as a city, but as a state, as a country, and as the world, we cut off that potential for variants. But I don't worry about a few cases of a new something. Please, I would encourage all of you, if you're interested, pay attention when it's a variant of interest. If it's a variant of concern, you'll be hearing about it because we may need to do things like masking, and we'll probably see surges. And if it's a variant of high consequence, you won't miss that because we probably would need to do even more dramatic things. I don't want to see a variant of high consequence. I want the Delta variant to be our last variant of concern. I don't know we're going to get that lucky, but I'm not particularly worried at this point about the new ones and that we will continue to see emerge.
Thank you, Dr. Eric Rung, WGN.
One second before you ask the question. I noted as Dr. Arwady was talking that there's a lot of attention being paid, and rightfully so. This is a voice of truth, a voice where you can get actual facts. And I want to remind people that, that's right. I want to remind folks that the whole CDPH team has been working literally round the clock, tirelessly throughout the entire pandemic. But where you can get information, if you've got any question whatsoever, go to our website, citywide.gov/COVID. There's a wealth of information on that website. It is updated on a daily basis. That's the place where you can go, where you don't have any concern that am I getting the truth or not. And the other thing is, Dr. Arwady is still doing her Facebook shows twice a week, Tuesdays and Thursdays. So the doctor is in Tuesdays and Thursdays if you've got specific questions or you just want to get updated on what the latest happenings are, please tune in there as well. Thank you.
I was hoping the doctor could stay in for a moment.
She can.
Thank you. Doctor, the mayor had said that she would like you fully involved when it comes to CPS moving forward with safety protocols. Fully involved, what exactly does that mean? Because CPS has said that CDPH has been involved. So what areas will you be looking at specifically?
Yeah, absolutely. So we recognize that Chicago Public Schools itself is the size of a not very small city, right, where you're talking about more than 300,000 people. And so while CDPH in its formal role, of course, is giving guidance and working with all of the schools across Chicago, obviously Chicago Public Schools we do work closely with. And as this school year has come back, and we've been so excited to see all those kids back, and really, for me, there's not a better sign of being able to be open and safe than having the kids back in school. There has been a lot of interest, not surprisingly, and we've been working very closely with CPS on a few things. Number one, I think, is related to basic data and making sure that as data is being shared, that we are doing a good job of putting it into context, because I do think it can be very scary for parents to see on the CPS website, you know, there's been 500, 600, 1,000 potential cases of people who have been diagnosed with COVID who have been in a Chicago Public Schools. That sounds really scary to a parent. What we are working with CPS to do is to help put those numbers into a little bit more context for our city, because when I hear a number like 500 or 1,000 even over almost 4 weeks of school, I know that does not mean 1 in 100 children are being diagnosed, which is a number that someone had suggested. It does not mean 1 in 1,000 children are being diagnosed. It does not even mean 1 in 10,000 children and staff are being diagnosed every day in Chicago. It's more in the range of 5, 6, 7, 8, maybe up to 10 right now per 100,000 students and staff in CPS have had that positive COVID test and then have, potentially been in school and transmitting at that time. And so I cannot guarantee, there is no such thing as a completely no risk environment, but I think it's critical, and there actually is, I think, some work to do in terms of some of the communications around risk, as well as the many, many things that CPS has put in place and is ramping up further. So my team has been involved in everything from looking at the data and the website. We've been heavily involved with any situation that actually suggests transmission in school. Because remember, those 500, 1,000, whatever it might be cases are just people who were diagnosed with COVID and in a school building. It does not mean they caught COVID at school. Wherever we have any suggestion that there is a cluster, an outbreak, or signs of transmission within a school, we are very, very heavily involved. We've been working with their contact tracing team to make sure that things are moving as efficiently as they can. They're hiring some more staff to make sure we can quickly move on that. And I can tell you, since school started, how many schools are there? More than 500? We've got fewer than 10 situations that we think may have even suggested transmission within school. These are not major outbreaks. The biggest one involves 4 people. They're 2 to 4. And even the 4-person one, 3 of those people were in an outside school, environment where they're getting together. So I think that it's important to put some of this in context. We've also been lending a lot of expertise in terms of working really closely with the CPS team around standardizing and trying to tighten a little bit some of the interviewing work, so that we're just, when the numbers are high right now, making sure that resources are going out quickly. And then I think they've done so much of that hard work already. All of the work of investing millions in the physical infrastructure, in the air, having the industrial hygienists in all the spaces. They've obviously got the masks in place. There's been work around, are there other distancing things that they can do to help cut down on quarantine? And then as they've been ramping up testing, of course, we've been saying we really want to see this across the system, and that is their plan. I know they were in at least 160 schools doing that surveillance testing last week. I think they're going to be in more than 300 by the end of this week, and that's good. But there's just a lot to do, and we are very happy to help with the comms, with the data, with the operations, and then frankly with vaccine. We see schools as an important place where children with parental and guardian consent can get vaccinated. So there's a whole range. My whole team is working on it.
Just to put it maybe a little simpler, are you concentrating mostly on just the data then? Because that's what it sounds like, and just putting things into context.
No, I started with the data because I think that, when I do my Facebook Lives, when I see the letters people are writing me, I know that there are a lot of people who see numbers in the hundreds and are worried. So I was using that opportunity to also just help people who are watching this put those numbers into perspective. But no, my team has been working all along, but we've really, I think just with the number of students and staff, have really gotten even more involved with CPS on really all aspects. So really streamlining contact tracing, helping out with some of the case investigation, making sure that the data is flowing appropriately, working with a lot of the ways in which can we speed up the way communications are happening to individual parents, thinking about ways to use our robocall system, a lot of things just to say, let's make sure we're doing everything as efficiently as we can, because I am extremely confident those schools as a school system are safe for children, and I don't want to see worries over the start of school be undermining that trust in those schools.
All right, Sarah Schulte, ABC 7.
I know we're talking about a goal to get first shots. What is the city plan? This is probably a question for you, Dr. Arwady. What is the city plan for booster shots for 65 and plus, since that's probably going to be signed off today by the CDC?
Yeah, so obviously we'll be waiting for that CDC guidance officially. I was very pleased to see where this landed in terms of recognizing that where we have seen some of those breakthrough infections, they remain relatively rare, especially for hospitalizations and death, but they do tend to be in older Chicagoans. But the CDC will be doing some more definition around other risk groups, whether that is by other medical conditions or by occupation. And so we have been planning for all eventualities here. The good news is we have plenty of vaccine available. We've been working with our pharmacies, our medical partners, to make sure that they have the supplies, the information. We also are in flu season right now, and so frankly, thinking about combining a lot of our flu work with the potential for COVID vaccine, whether that's first and second, most ideally, or the boosters, is going to be a way to sort of efficiently get this done. So all of the CDPH flu clinics, for example, will be offering the Pfizer vaccine at the same time. You can get your flu shot and a COVID either first or second dose or a booster at the same time. There is no problem with that, and we think that'll lead to some efficiencies. We're obviously following the data already on the people who are immunocompromised have gotten that third dose, and we'll be doing a lot, I think, to educate folks about what they need to do next.
Could you also quickly clarify the way that you track data? On your website, on the dashboard, it's done by, vaccine allocation is done by zip code. And there are zip codes still that are below 50%. Yet you said today that the 77 communities are above 50%.
Yeah, so let me clarify that. So it's not vaccine allocation by zip code, it's actually the number of people who live in that zip code who have been vaccinated. So just to clarify that a little bit. So if you go to the website, it defaults to all Chicagoans, not to those 12 plus. You actually have to click to get to those who are actually eligible for vaccination right now. And I've asked the team to potentially flip that, just given some of these goals. But when you go to 12 plus, you'll see that all of the zip codes have hit that 50% mark. There are a few right around the edges, 60633 in the bottom right, and a couple more that we share the zip code with Cook County. And so that can sometimes be a little confusing because we technically have the responsibility for the Chicago residents and vice versa. But every zip code in Chicago has reached that 50% mark. Community areas are smaller than zip codes, and so one of the reasons we distributed that community level data is that there are some community areas still where we need to still get to that 50% mark, and we will absolutely do that. Our website is set up by zip code because we update it very frequently. That is the data that comes into us. That's how data is reported. Our epidemiologists behind the scenes work to put that into community areas, in light of Protect Chicago 77, we will also be sharing that at the community area level, like we distributed today.
All right, Cheyenne Daniels, Sun-Times.
Hi, thank you so much. So as the doctor mentioned, we are approaching flu season. The Delta variant is a variant of concern. We are seeing breakthrough cases.
Can I just clarify, you asking question for the
both.
Dr.
This is for both.
Right.
Is there any preliminary plans or anything to keep in mind for potentially, if situations get worse, for closing the city down, whether partially or fully as we did last year as we head into flu season and potential variants?
Let's not go there. We're nowhere near that. We're nowhere near that. I really want to emphasize that. We are nowhere near that. And I'll have Dr. Arwady talk to you a little bit about the numbers. What we've seen over the last 2 weeks is a flattening of the numbers. We're not down where we were when this latest surge began, but we are seeing no question whatsoever a flattening of the numbers. I don't see anything on the horizon. And again, this virus is, unpredictable, but certainly I don't see anything on the horizon. Our modeling doesn't suggest that we will get to a point where we need to shut anything down again. That is the last possible resort, and we are nowhere near that. But having said that, vaccine. We've got to get people vaccinated. We've got to continue to push forward, which is why we're here today. But I don't want any reporting to come out of here that we're even suggesting that we're closing the city back down, because we're not.
And can I?
Yeah, sure.
Yeah, just to put a little bit of a data point on that. For those of you following the dashboard today, we're at 422 average cases. We're still over that 400 mark, but we've seen huge increases in testing. And in that context, I'm very happy with where those numbers are. Our Delta surge here was not even as great as our Alpha surge, which was back in March and April, while we weren't fully open at that point. At this point so far, the highest we got in cases was between that 500, 600 mark. The highest we got in positivity stayed under 5%, and today we are at 2.9%, the lowest we have been since July. We're not done. As we head into the cold season, I am concerned. It would be irresponsible of me not to be concerned, because we typically see respiratory viruses flourish here when we move indoors. So one of the reasons why we're pushing COVID vaccine and flu vaccine for everybody is to help protect the hospitals. Our goal, you have been hearing us say all along since we opened, is to stay open and do that safely. The things that, for me, could change that conversation would be if we really saw things get very out of control to a point where we were threatening our healthcare system. We have seen around the country that is not just a theoretical, it has happened with the Delta surge, and we start to see that in serious ways. You all know that matrix we follow, like those are real numbers that we follow, and when we see us start to move into those higher risks, that's when we did things like put the masks on. These are based on doing everything we can to stay open. The other thing is if we were to see a variant of high consequence emerge to a point where our vaccines really were not working and we had to potentially, heaven forbid, start over with vaccinating everybody, that could be a setting. But our intention, please, is to not have to do this. We've had enough indirect effects of COVID, and the vaccine is the most important tool that helps us stay open as a city, and trust me, that is everybody's goal.
Aaron, Hyde Park Herald. Hi. One short one and two longer ones actually reflects the other one, and they're both for Arwady. I just wanted to make sure that the 77% eligibility mark that you have will apply or incorporate 5 to 11-year-old Chicagoans once they're incorporated. No?
So we have specifically, to set this particular goal, given there's still a lot of uncertainty, we don't know for sure that the 5 to 11-year-olds, I expect that they will likely have a vaccine authorized probably early November, possibly late October. We don't even know that for sure. We don't know the timing. So the goal that we set, this 77%, is the city goal for at least first doses. And as you heard us say, the stretch goal would be the double doses at 77%. We're over 70% right now, but for 12 and up, yes, thank you. For those 12 and up, we're over 70% right now, but we've only been growing as a city, 0.4, 0.5% a week. We've got to step that up to be able to reach this goal.
You've referenced extreme risk to unvaccinated people. I'm wondering what that means to our hospitals going forward. I've already heard nurses complain about unsafe staffing levels right now with this fall and winter. With so many unvaccinated people, I saw a couple of weeks ago that we were already at 80% ICU capacity, which I think would previously have put in state restrictions.
Yeah, so let me put that in some context. Before COVID ever came to Chicago, our ICUs regularly in Chicago had only a 15 or 20% capacity because we have a lot of ICUs. We are a place that the whole region refers to, and so us having 15 or 20% capacity is not the same thing as us having a single hospital, and that means a few beds of capacity. We watched this across the system, and in fact worked with the state to make sure that that was dropped as a requirement, just knowing what our baseline data were. So we think, as you know, vaccination is required for healthcare workers. That is absolutely critical for protecting that population. And obviously, all of the protective measures remain in place. And if boosters are recommended for healthcare workers, we've already done the work and the conversations with hospitals for the planning around that to make sure that they are prioritized and are able to have that access as well.
Now, I know the 77% goal is not 77% across across every neighborhood, but you said at one point that you want to get every neighborhood done. A lot of the neighborhoods in my coverage area or outside of my coverage area have 30% away from the 77% goal. Neighborhoods like Washington Park and Woodlawn. How is this going to be accomplished? We're only seeing 5% greater vaccine uptake week to week.
Yeah. So 77% is our citywide goal. That is a bit of a stretch itself, to be honest. If you look at where the country is, if you look at how much harder we're working at this point for every vaccine. The point that we're trying to make is that in the community areas that have the biggest room to go, those are the ones with the most opportunity. Like here in Englewood, made the biggest progress in the prior week. I love that. It's the places where we see that biggest growth are doing the most to protect our whole city. But there is no community area that's done, especially when you look at our oldest group. I mean, if you've been following this, we're not as vaccinated as we need to be, especially for those over 80, and I continue to worry about that. So we've elected to set, and you've probably seen each week, we celebrate when we see zips or community areas hit that 50% mark, hit that 60% mark, hit that 70% mark, hit that 80% mark, and we had our first 2 zip codes outside the north side this week hit that 80% mark. We had one on the northwest side and one on the southwest side, 2 of the communities hardest hit by COVID all along here. So I don't want this to be a competition between neighborhoods. I want this to be a recognition that every single neighborhood has room to grow here, but the neighborhoods with the biggest room to grow are also the biggest opportunity.
All right, Dame Plago, Fox.
Yeah, Mayor, I was wondering if you could talk a little bit just about the mechanics of rolling out this new public relations campaign.
Yeah.
How are you planning to get the message out, especially at a time where there's already so much noise around the subject of vaccinations?
That's a great point. Look, a couple of things. Obviously, making this big announcement today with myself and Dr. Arwady really leading this initiative. We're going to be leaning into our community health equity partners like the Greater Auburn Gresham Development Corporation. As Dr. already said, we've divided the city up into 6 zones. There's a lead in each zone, but then within each zone, there's a bunch of community organizations that have been working on a range of different health equity issues, particularly related to the pandemic. These are the folks that are on the ground, like Team Inglewood, like some of the other organizations that are here who really know their community and are literally walking the streets every day. So we've got to lean into those folks, provide them with a lot more resources, make sure that they have the tools that they need to have those challenging conversations. But that's really where a lot of the focus is going to be. We've been providing incentives to people to get vaccinated. We're going to continue to do that. But this citywide focus with a lot of attention and really getting individuals and businesses to take this pledge is really what this is going to be about. And we're going to be doing regular updates, Dr. Arwady and I and the larger team, to make sure that we're bringing attention and focus, and we need the help of the media as well, because this is the only way that we're going to truly be able to put COVID-19 behind us. So this isn't one and done. This is the start of a new chapter in our fight against COVID-19, and to really educate people about the absolute dire urgency of getting vaccinated. I put those statistics out. The average of 15 times more likely for unvaccinated people to die of COVID-19, 50 times more likely if you were Black and Latinx and 50 or 60 years old. The reason that we're emphasizing that is because we want to break through that noise. There is a tremendous amount of noise, and Pastor Chris said it, so much different disinformation that's out there. I urge everyone, go to a trusted source. The source I rely upon, that I urge everyone, is right here. Dr. Arwady, CDPH, CDPH.gov/COVID, all the information that you're going to need, all the myth busting that's out there. There's so many myths that are out there, and we are regularly going into community at the grassroots level, at the block level, and trying to disabuse people of their concerns and really take the time with them one-on-one to talk about their concerns, help educate them, and literally going door to door, bringing the vaccine to them. One of the most successful programs that we've had of the last, this latest stage of our COVID work is going into homes and bringing the vaccine. Anything that we need to do to get people vaccinated, we're ready, willing, and able to do that.
All right, Amy Jacobson, WIND, last report of the day.
Hi, I have 3 questions, and I'll try and make it quick. I think this question will probably be for you, Dr. Arwady. How did you guys come up with 77? Why not? What's the science and data behind that, or is it a play on the fact that we have 77 communities?
Yeah, it's a play on the fact that we have 77 communities. As you know, there was a national goal for 70%, and we are past that. But I felt like this was a goal that was a stretch for us, but still one that with a lot of attention we would hopefully be able to meet. And having more than 3/4 is generally recognized as being in a pretty good place in terms of COVID. Look, I want this to be 80. I want this to be 85. I want this to be 90. But we were looking to set a goal that we felt like, with a lot of extra attention in this last quarter of the year, we hopefully will be able to reach. And I would feel a whole lot more comfortable going into the winter like that. And can I just add very quickly on what the mayor said just now? Each week you're going to be hearing some more details in different areas. So for example, businesses will have the opportunity where they are requiring vaccination for their employees, or they are checking vaccination or testing for people who are coming in. There will be an opportunity to, if they are interested, certify, register, put something in the window, and then also there will be, for Chicagoans who want to support businesses doing this, there will be some opportunity to say, this is a restaurant I want to go to, this is a shop I want to go to. So that'll give you a flavor of it, but we see this as a campaign really over this next month with different focuses each week.
All right, so we have 324 CPS kids who've tested positive for COVID. 10,000 are in quarantine. And last time the kids were out of class, we had 83 kids shot during school hours. And I know that both of you care about the kids. I'm with the kids, and we're going to have mental health issues all over again because they're locked out of government schools. So is it time now to redefine close contact? If kids are masked and sitting 3 feet apart, and Jimmy's in the front row, and Sally's in the back row, and she's COVID positive, asymptomatic, is it time to redefine what close contact is, just so that we can keep these kids who desperately want to be in school and play sports back in class?
You asked me about this yesterday, and I'll say...
Right, and the number's going up.
Yeah, so I feel confident that that number is going to go down. And it's going to go down by making sure that the protocols on who should be quarantined are tightened up. That's precisely why Dr. Arwady and her team are working diligently with CPS on the ground there to help them understand how to make those decisions and not just leave it to building principals who I think are rightfully being cautious, but doing it in a way that I think is not necessary and disruptive of the school experience. So I'm confident you're going to see those numbers go down, not because we're doing anything, cutting any corners, but we don't need to have mass quarantining. That is not a thing.
Dr. Did you want to?
I think we will be looking at the data from these first few weeks. I expect that a lot of those quarantined children and or adults, I don't expect we will see a lot of COVID transmission in those groups. I don't think a lot of them will end up testing positive. I think having that local data will hopefully help the various stakeholders feel confident that we can be in a place to do what many jurisdictions around the country, many school districts have already done in terms of of making sure that when we are doing that contact tracing, we are using a definition that is the least disruptive to school as possible. But I know that people want to see the data on this, and they want to see it locally. So we've seen around the country, often as schools have been in for a few weeks, and we see that, in fact, schools, as we've been saying all along, are not major sources of spread for COVID. We then have some local data to have that conversation with the stakeholders, and you know how I feel about this, really want to do everything we can to keep kids in school in a way that remains safe from COVID. So I think that will be something that continues to evolve over the next few weeks to months.
And last question is for both of you. When it comes time, because 6 months after your second shot, are you both going to be taking the booster shot?
I'm going to follow the advice of my doctor on that, but I would expect that I would take the booster, yes.
What about you, Dr. Arwady?
So I'm not over 65, so we will be waiting to see what the CDC says specifically, and then once we have those formal recommendations, obviously we will be following those recommendations of the scientists. But I want to wait to see what's there, and the only thing I feel pretty confident is likely to be there is people over 65, who, when I look at the data, are the ones who will benefit the most from a booster shot. And leaving vaccine for people not yet vaccinated is critical, including around the world. And I think this is a very good place to start with that booster conversation.
Thank you, Doctor. Thank you, Mayor.
And to be clear, just one last thing, I'm not over 65 either. I'm not rushing it, but I'm expecting that the over 65 will be expanded to other categories, which might make it. But that's why you gotta consult with your healthcare physician. Let me just also say this: one of the other thing I think that we shouldn't miss about the schools. Part of the reason I'm confident is not only tightening the definition around and really being much more precise around case investigation, so we understand who the contact was with, helping those building principals and the staff at the schools do a better, and the folks that are doing the case investigation and the contact tracing do a better job. But also keep in mind, October 15th is a deadline for all adults in CPS to get vaccinated. So that number, I think, will also help drive down the number of cases that we're seeing as well. Thank you all.